consciousness, patient was conscious but not willing to speak. Higher mental function, forgetful, especially cannot remember the recent events or recent things. Facial expression, masked face, that is the patient was showing null expressions. Resting tremors of hand. Sensory examination, sensory and motor examination was not significant. Tone, in motor examination, we saw the tone of the patient, the tone, rigidity of all the four limbs, power grade 2/4, coordination. Uh, in coordination, we did supination and pronation. On supination, the hand sparsity of the muscle noticed. The UMN sign positive. Kinetic tremors, finger nose test was performed and found simple kinetic tremors. Toe tapping examination was also done. Both side movement reduced and slow. The right foot, in right foot it was more than left foot. Finger tapping examination was done and it suggested decreased movement in both the hands. Right side was more than the left side. Yes. Reflexes, superficial reflexes delayed, deep tendon reflexes delayed, glabellar tap was done, eye blinking movement was slow. Now, differential diagnosis as symptoms of Parkinson's seen in other diseases. So it is differentiated between Lewy body dementia disease.
I'm sorry, I'm disturbing you. Can you go back to the motor examination again?
Yeah. Yes, sir.
Komal, don't mind. This is Ninad, sir.
Okay.
Yes. Please go back and answer what he wanted to.
Motor examination.
Yeah. So, shall I repeat the motor examination?
So, this power was in all four limbs or it is unilateral?
It is for all four limbs.
With grade 2 power, the patient won't be able to walk.
Okay.
I'm sorry? Hello?
Yes, somebody is unmuted. That's why we are getting the disturbance.
No problem. So, the power grade is not normal. With that power 2/4, the patient won't be able to walk. So, probably you may need to assess the patient again. What was the power exactly? Was he able to walk, madam?
Yes, sir. He was losing his control while walking, and he was slightly while walking here. His balance was on the left side. He was falling on the left side.
Okay, so balance and power are two different things, right?
Okay.
Power is whatever you see on examination, even if the patient has ataxia, even if he is not able to stand due to ataxia, imbalance, falling constantly, still the grading of the power should be as written in the books. Okay, grade 2 is he is not able to lift his limb against gravity.
Okay.
That is the grade 2 power. And if he is not able to lift against gravity, he won't be able to stand.
Okay.
You got me? So that you have to change.
Okay, sir.
Right?
Yeah.
And below you have written finger nose test was performed and simple kinetic tremors were found. Tremors you should note separately. Tremors should be noted separately. Tremors, any other involuntary movement should be noted separately, and finger nose test is just to test for incoordination. It will tell you whether there is incoordination and there is no incoordination. Dysmetria, you call it.
Okay.
That much you have to tell only.
Okay.
So tremors are different. Finger nose test is done for a different thing. Okay?
Okay, sir.
You can go on then.
Okay. So, reflexes, differential diagnosis, Lewy body dementia disease, Huntington's disease, Parkinson's pulse syndrome, and Alzheimer's disease. So this case was already diagnosed by neurologist as Parkinson's, and for a prognosis purpose, we perform unified Parkinson's disease rating scales, and the score was 73. Final diagnosis was Parkinson's. Thank you.
Okay, have you done with your case now?
Yes, ma'am. Yes, ma'am.
Okay, sir. Actually, Ninad sir, for your kind of information, this was PG student, second year PG student, Komal Borse from Motiwala National Homeopathic Medical College.
Right,
So,
ma'am.
yes, she presented her case, and now I request you. Actually, it is my I feel honor or privilege to introduce you,
Thank you,
sir.
ma'am.
Dr. Ninad Thorat, sir. Dr. Ninad Thorat is senior consultant and neurologist and has consulted many n number of patients in all over Maharashtra. To mention a few. So, sir is with us today with his he has spared his precious time to guide us. So, I request sir to enlighten this case allopathy point of view, or what is your expert opinion about the Parkinson disease. So, our student, all the students who have joined here and on YouTube, get some better knowledge about the Parkinson's.
Right, ma'am. Thank you so much. Thank you for having me on this platform.
Yes.
I feel honored for this. Thank you very much. Uh, Coming to the initial presentation of the patient, whatever I noted from the history, the patient presented with increasing tremors and imbalance and slowing of activities, I suppose. That was after 2021, I think. So, am I right?
Yes.
Right. So, within 2 to 3 years, progression to such a state where the patient is unable to stand, walk, and has developed psychiatric symptoms in the form of irritability and doesn't want to follow what he is told. That is usually not seen in Parkinson's at such an early stage of the disease. And the symptoms started bilaterally. Another thing, very important thing is the symptoms started bilaterally. In Parkinson's patient, usually a single side will be affected first. So one hand, one leg will be affected first. The relatives or the patient will notice, they will come and tell you that my left hand is shaking for some time now. For last 6 months, my left hand is shaking. Or he will or she will come and tell that my left foot is feeling a little heavy. I cannot walk normally as I used to. My leg feels heavy on one side. Other thing they might complain is that my relatives or my family members are saying that you have started walking slow. So this starts usually on one side and then progresses to the other. And it takes quite a while for the patient to have progression to the other side. So at the onset only, the history doesn't fit into a typical case of Parkinson's. This goes against Parkinson. He start presented with bilateral symptoms at the onset. If I can just see the slide at the, if the presenting student can just put on the slide.
Which slide, sir?
The initial three slides.
Your slides again. Komal.
Yes, ma'am.
Initial 2 slides, please.
Sir, the patient represented with
Yeah,
right side tremors.
I cannot see the slide.
Yes, I'm sharing it.
Yeah.
You have shared already. Just scroll on.
Just
Scroll
go to the first and second one.
He received.
Yes.
Yeah. So third, next one. Yeah. See. Now, no, before that.
Okay.
So presenting complaints of weakness, dizziness, tremors in right hand. Okay. Gradually since 1 month. He used to walk 10,000 steps, but with low confidence now. The thing that you have said that within a month, all these symptoms progress. So he came to you with a 1 month history and he has progressed to a state where he has imbalance. You said that he cannot stand, right? So that usually is not seen in Parkinson's. Parkinson's course is very slow and very gradually it increases. So this goes against, this 1 month history goes against a typical case of Parkinson's.
So
right?
what happened in this case actually, within 1 month, he had tremor in the right hand, and after that, while walking, he lost his balance and he fall down 2 to 3 times on the left side.
right?
Hmm.
Right. That's fine. That's fine. So imbalance in the initial stages is again another point which goes against idiopathic Parkinson's disease diagnosis.
Okay.
Right. So we'll go to the next. Another thing is dropping things from the hand. It is not very typical of any disorder in this case, like in case of Parkinson's. Maybe in other things, but doesn't look like it is in favor of Parkinson. Another thing is difficulty making chapati, pieces of chapati. So that tells you that the patient has distal weakness, matlab weakness of the fingers or the hand. So that is not seen in Parkinson's. Weakness is very rare. So we will keep this aside. Probably we may need it later on, but difficulty making chapatis is not a very typical symptom of Parkinson. So even if you don't note it, it's okay.
Okay.
Next slide. So you have said here that he has undergone some surgery for the brain. So he had SDH, right?
Sir.
He had SDH for which he has undergone some surgery. Was he treated with surgery or with conservative management for SDH?
No, sir. He was treated with surgery.
Right. And this was in 2021.
Yes.
Right. And this is one thing that probably says that this is probably post-traumatic Parkinsonism that he has developed. So after some trauma, injury to the brain or something like an SDH, over a period of time, the patient might develop Parkinsonian symptoms, but it is not termed as Parkinson's disease. You understand me?
Okay, sir. Yes.
Right.
Great, sir.
And difficult to rise up from sitting, right? Cup falls. Okay, being lethargic, dull is okay. That can say that the patient might be having some Parkinsonian symptoms. Next slide. Another slide. Next. Next. So walking slowly with short steps, with stooping forward, posture, thin, conscious. Okay. Memory affection is also not in like seen in early stages of Parkinson's. It might be because he has had a trauma. The patient might have developed gradual amnesia. He has difficulty of remembering things.
Okay.
Right. Uh, okay. Masked faces, you write. Okay. Masked faces also fine. Masked faces. Resting tremors. Right. Next slide. Okay. So see, whatever examination and things you have mentioned here, they say that the patient might have Parkinsonian symptoms, but it is not Parkinson's disease per se. Till now, we have come to the examination. Whatever you have mentioned, it doesn't fit in Parkinson's disease. It can be Parkinsonian symptoms. So Parkinsonian symptoms, as you have mentioned, they are seen in multiple diseases. So Lewy body disease you have mentioned. Lewy body disease will have dementia. So that this patient also has memory issues. He is little irritable, right?
Yes, sir.
Irritable, doesn't follow commands what you tell him. He doesn't want to cooperate. Is it right?
Yes, sir. He was
So
not
this
answering.
are not answering. So these patients, Lewy body dementia can be a possibility instead of Parkinson's disease. Lewy body dementia can be a possibility where you see Parkinsonian symptoms. Lewy body dementia में patient will have more dementia. It is rapidly progressive, fast progress होता है. In contrast to Parkinson's disease, which progresses over 5, 10, 15 years slowly. Right. And other thing is you have mentioned Parkinson plus syndrome in the differentials. Parkinson plus syndromes में there are multiple different things. You have mentioned multiple falls. So Parkinson plus syndrome, it contains PSP, that is progressive supranuclear palsy, MSA, which is multisystem atrophy. So these are few Parkinson plus syndromes which can be rapidly progressive in contrast to Parkinson's disease. Parkinson's disease patient will progress very slow, gradually, dhire, dhire, dhire. For years, he won't be having many problems. But these patients, especially Parkinson plus, these patients will have multiple falls. Which patients? Parkinson plus syndrome. हाँ, तो उसमें PSP. PSP is progressive supranuclear palsy. These patients have developed a little dementia a little early. They fall multiple times. Where was he falling? To the front or to the back?
Sideways.
Sideways. So these people have more falls. So it can fit into PSP also. He was having anything. Did he complain that he's difficult to look for obstacles on the way when he's walking? Does he say that?
No, no complaints like that.
No complaints like that. Right. So what we will Huntington's is doesn't fit into this. Huntington's disease progression and onset is completely different.
Mhm.
Yeah. So it doesn't fit into this. LBD, yeah, LBD I can say. Parkinson plus I can say. Alzheimer's, not very sure. Alzheimer's patients are not very typical. Whatever you have told in the history, apart from the mood changes and the memory issues, other things don't fit into Alzheimer's.
Mhm.
So what I would suggest is our differential at the end of this discussion will be Parkinson plus syndrome. It can turn out to be anything later on,
Okay.
right? Some patients of Parkinson's which look like PSP, they turn out to be MSA later on. So these things are quite overlapping. For many years, you won't be able to tell completely whether this is Parkinson plus or Parkinson disease. You got me?
Yes, sir.
Treatment for most of these diseases is almost the same.
Hmm.
Yeah. So anything, ma'am, the students need to understand. I
Like
can
you said, at the end of the
elaborate.
discussion, we all come to know that this case was not about the Parkinson's disease per se. This is the post-traumatic Parkinson's symptom.
Parkinsonian symptom. Yeah.
Yes, very well explained, sir. But now my question, I am the representative of all the participants who have joined here. But our question is that kindly have some light on Parkinson's disease.
Right.
So
Right.
how it progresses, how it is, what is its prognosis, and
Right.
main what is its treatment.
Right. So Parkinson's disease basically is a neurodegenerative disorder of the brain. Neurodegenerative disorder, like the neurons in the brain will degenerate. Simple. The degeneration in Parkinson's disease, it starts in the substantia nigra. It is a part of the brain in the midbrain, and there are neurons in substantia nigra. It looks black. That's why it is called substantia nigra. Nigra is black. It looks black on biopsy when we do the dissection. So it produces dopamine. Dopamine is a neurotransmitter in the brain. And when dopamine production comes down because the substantia nigra cells start dying, and when they die off, multiple neurons die over many years, then the production of dopamine reduces, and dopamine is responsible for smoothing your movements, to control the speed of your movements, to control the extent of your movements. So dopamine, if it is low, the places where it acts in the brain, those places will have less control from dopamine. Dopamine will lose its control over those areas. So the speed of the patient will come down because dopamine is responsible for managing the speed of your movements. If I want to walk fast, I will think about it and I'll start walking fast. But Parkinson's patient cannot do that. Even if they decide that I have to stand up and walk fast, the problem starts with standing also. Even to stand up, they will have problems. They will take a lot of time because dopamine is, if the patient has 100 molecules of dopamine in a normal patient, a Parkinson's patient will have only 10 molecules of dopamine. So 10 molecules will take very long time to complete their action.
Okay.
So this is the pathophysiological basis of Parkinson's. Parkinson's usually starts in the age group of 50 to 60. In lesser age groups, it is called young onset Parkinson's. Young onset Parkinson's patients have usually some kind of hereditary background to them. Someone in the family might be having Parkinson's if the patient has developed young onset Parkinson's disease. Second thing is, initially many disorders might mimic Parkinson's, as we just discussed. This case was post-traumatic Parkinsonian syndrome, extrapyramidal syndrome. So multiple things can be overlapping initially. So even if we think that the patient has Parkinson's at outset, the patient comes to you and the Parkinsonian symptoms are there. Later on, the patient might turn out to be some different kind of disorder. So this should be constantly watched for. Every examination at every clinic visit should be done completely so that we don't miss anything. To investigate Parkinson's, it is purely clinical based. Like we check for pneumonia with X-ray, Parkinson's doesn't have any typical investigation that will tell you this is definite 100% Parkinson's disease. It is all clinical diagnosis. And some newer techniques that help us to find out whether there is any problem in the substantia nigra, whether there is atrophy. We do a TRODAT scan. It
Which
is a
scan?
TRODAT, TRODAT.
Okay, TRODAT.
TRODAT scan. And there are some other functional MRIs also, fMRI we call it. Based on these new investigations, it is a little helpful, but still clinical is always the best. So these are just, we don't do it usually. On a routine basis, we never do these things. But in some cases, we might need their help when we don't know whether this is definite Parkinson or something else. Treatment wise, now because dopamine is low, we have to give it with medication, synthetic dopamine. So we give it with levodopa, that is levodopamine, along with carbidopa, which will reduce the peripheral degeneration of dopamine, so that in the brain it acts better. So the medications that we use are levodopa, carbidopa, entacapone, pramipexole. Then there are triaxiphenidil. All these medications are used in Parkinson's disease. Levodopa will do the action of dopamine, will act on the dopaminergic neurons in the brain and help the patient to walk faster. As I said earlier, Parkinson's patients will have 10 molecules of dopamine, for example. So with this medication, we are increasing at action of 10 molecules with another 10 molecules. So they will double their speed.
So does the dopamine transmitter device helps the patient?
No, there are pumps of dopamine that we get. They put a needle in the skin, and gradually little bit of dopamine is released in the body. That is called a dopamine pump. You call it deodopa.
Okay.
So the deodopa helps to give a sustained concentration of levodopa in the body, because the levodopa has quite a lot of side effects when you use it. Increase the production of dopamine. So yeah, there is no specific drug that increases dopamine, but there are things that act like dopamine. So they are called dopamine agonist drugs. So what these drugs do is they will act on the receptors of dopamine, making the receptor think that actual dopamine molecule is attaching to them. But there is nothing that will increase the dopamine production, because to increase the dopamine, the factory should be working properly. Here the factory is not working. Factory में machine 5 में से 4 बंद है. Only one machine is working. So उसमें से ज़्यादा production नहीं हो सकता. There is limited production and we have to manage with that. That's why we have to give more dopamine from outside.
So then how to consider the side effect of these all levodopa and carbidopa, as the patient get hallucinations and all those?
Yeah, dyskinesias are the most common problems with levodopa. So there has to be a constant revision of drugs every time the patient comes to you. The patient on examination will notice that the patient has developed dyskinesia. So we alter the dose. We change by a little bit, maybe half or 1/4 of the drug is reduced, and we add some other medications like amantadine. This reduces the dyskinesias in a patient. Amantadine is used in Parkinson's and Parkinsonian patients to reduce the motor symptoms and the dyskinesias of the patient.
Okay. Second, another thing is then when the Parkinson's gradually progresses and prognosis become bad, when the patient becomes totally bedridden or unable to do his activity of daily living properly, then how should we take care of him, or is there any solution to take care of him properly? It is
After
palliative question, palliative point.
palliative care. Yeah, palliative care is a family issue, ma'am. Whole of the community should be involved. The doctor, nurse, the physiotherapist, the person who's taking care at home. All these should be involved when taking care of the Parkinson's patient, because first of all, their confidence should be kept high. And routine physiotherapy is advised because they develop quite a lot of stiffness of the body.
Okay.
Activity is one thing that will keep this stiffness or the rigidity, we call rigidity. That has to be kept in check, and that has to happen with physiotherapy. Because other drugs, as it is, we are going to give, but because to reduce the side effects of the drugs, we may need to reduce the drugs, and when reduce the drugs, the rigidity increases. So physiotherapy is one thing that definitely helps the patient to reduce rigidity. Walking, the gait improves, the confidence improves.
Okay. And sir, what do you think in this palliative care, if Ayurveda can help?
Sorry?
If Ayurveda can help or homeopathy can help?
Yeah, definitely. I would now.
But as a senior neurologist, I just wanted to know from your side, what do you think if the Ayurveda and homeopathy can do to this patient anything?
Definitely, ma'am. Now, one of my patient, she's from Mumbai. She has relatives in the US. So I recently asked her to get natural form of dopamine. It's called Mucona. You don't get it in India properly because the concentration is not managed. So this Mucona, you get it in powder form.
Okay.
If I can just get the details, 1 minute. I have the details. So Mucuna, Mucuna is the powder I have prescribed to her. It is around, it is given in calculation. Some few grams of Mucuna will give 250 mg of dopamine.
I'm not wrong, sir. The Ayurveda person can correct me. This is Mucuna means Mucuna pruritus. So what we call in Ayurveda it is kapikachu. So kapikachu.
It is a kapikachu.
If I'm not, this is Mucona. You are telling me, sir. This Mucona is actually Mucona pruritus is the Latin name.
And I'm not very much sure about it, ma'am. But Mucuna is the thing.
Yes. Actually, it is having wonderful result. Just we are having Ayurvedic expert to tell all these things.
Yeah.
Share Mucona pruritus हे कपिकच्चू नावाचं आहे बघा ज्याला आपण मला नाही सांगता येत ऍक्च्युली आयुर्वेदामध्ये आपण त्याला कपिकच्चू म्हणजे त्याला खाच कुयरी त्याला म्हणतो आपण.
येस आय एम ऑडिबल.
येस. तर त्याचे रिझल्ट आहे आयुर्वेदामध्ये. आय जस्ट वॉन्टेड टू शेअर विथ यू आणि तुम्ही पण तो पॉइंट रेज केला म्हणून मी म्हणजे विद्यार्थ्यांना कसं असतं की तुमच्याकडनं जर असे पॉइंट रेज झाले तर दे गेट एनकरेज की अरे न्यूरोलॉजिस्टला सांगितलं हे नक्की काम करतं.
Definitely. Because my patient was not ready to take levodopa. ती यंग पेशंट होती, यंग पार्किन्सन्स होती, फॅमिली हिस्ट्री काही नव्हती तिला. तर तिला शी वॉज नॉट रेडी टू टेक सिंडोपा. खूप दिवसांपासून मी 4 वर्षापासून तिच्या मागे लागलोय की आता तरी चालू कर म्हणून. तर शी वॉज नॉट रेडी. मला नाही घ्यायचंय. तिने ते काय वाचलं असेल आणि मला तो त्रास होईल, असं होईल, डिस्कायनेसिया होतील, ती घाबरून असायची. तर मी तिला फायनली आय आस्क्ड वन ऑफ हर रिलेटिव्स टू गेट इट फ्रॉम द US. तर हे US UK दोन्हीकडे मिळतं आणि ते प्रॉपर एकदम टायट्रेटेड असतं. त्याच्यात त्यांनी समजा सांगितलं की 50 ग्रॅम घ्या, त्याच्यात 250 mg असेल तर डेफिनेटली तुम्हाला ती मात्रा मिळेल. पण इंडियामध्ये जे अवेलेबल फॉर्म्स आहेत, जे ऑनलाईन मिळतात ना, ते भरोशाचे नाही आहेत.
ओके. येस, दॅट इज द प्रॉब्लेम सर विथ आयुर्वेदा ओनली. की प्रॉपर क्लिनिकल ट्रायल्स नाहीये, प्रॉपर या गोष्टीचं स्टँडर्डायझेशन नाहीये, त्याच्यामुळे
स्टँडर्डायझेशन नाहीये. हो,
थिंग्स आर म्हणजे पडद्याच्या आड असतात ह्या गोष्टी, असं वी कॅन से.
हो. कसं आहे, हे पण गोष्टी माहिती असणं गरजेचं आहे.
येस.
कारण प्रॉब्लेम असा होतो की वी विल गिव्ह द पेशंट क्वाईट अ लॉट ऑफ होप्स की अरे इथे मिळेल, तुम्ही इथून वापरायला चालू करा. दे विल बी व्हेरी हॅपी अँड ओव्हर अ पिरियड ऑफ टाइम विल अंडरस्टँड की अरे ह्याचा उपयोगच होत नाही. पेशंट म्हणेल तुम्ही माझे पैसे वाया घालवले. पेशंट विल ब्लेम यू की तुम्ही मला काहीतरी मागवायला लावलं ऑनलाईन, हे तर सगळं खोटं निघालं. सो अनलेस यू आर व्हेरी शुअर की तुम्ही जिथून मागवताय दॅट इज ट्रस्टेड अँड रिलायबल पर्सन ऑर शॉप, मगच तुम्ही करू शकता. But
Yes.
she's having wonderful effects with Mucuna. असं
Yes.
आहे. मग तिच्यामुळे माझंही वाचणं झालं भरपूर त्या बाबतीत.
Yes, yes.
असं आहे. Yeah.
Sir,
Thanks.
sorry to interrupt you, but even in homeopathy, we have this same medicine which is available and it can be used for these kind of neurodegenerative disorders. So
Ha,
the same medicine is, yes, available in homeopathy also in mother tincture form.
Okay, that's nice. That's nice.
Nice.
Acha, I didn't know this. I didn't know this. This is new information for me.
That is the
Acha.
only purpose of this meeting, sir, that we can get the integrated
Hello, ma'am.
solutions.
I am audible, I think.
Yes.
Dr. Santosh
Yes.
is here.
Sir, I'm Rasika, madam. I am turning to both of you now.
I want to say that Jhandopa is the product of the Jhando Pharmaceutical, which having this Kapikachu in standardized form and which is available in India.
Oh, wonderful.
So Jhandopa is the product. The Jhandopa granules are available,
Okay.
which are standardized, and the research are done to increase its dopamine level.
Correct. Sir, one thing I would just want to place my point here that even if this is a natural form of levodopa or dopamine, any excess of dopamine that we give to the patient is going to show its side effects in the form of dyskinesia or hallucinations. Because what the patient is getting is excess, and even if we are giving it through synthetic form or natural form, the titration should be done at every clinical visit.
Actually.
Yeah.
Yes. Actually, we had a very healthy discussion starting from the post-traumatic, starting from the Parkinson's, then the diagnosis turnover to the post-traumatic Parkinson's symptom. Then Sir Nina sir very well explained about the to us that is neurodegenerative disorder from substantia nigra to investigation to the treatment and then palliative care. We had a very healthy discussion. But according to Ayurveda and homeopathy, we had expert with us. We have Santosh Kamble. Santosh Kamble is associate professor in the Department of Swasthya and Yoga in D.Y. Patil Ayurvedic College. He is having more than 13 years of experience, and without wasting the time of all of us, I request sir to share his view about Parkinson's and Ayurveda.
Thank you, ma'am. I am audible.
Yes, you are.
Thank you, Nina sir. I am such a grateful to listen you.
Thank you, sir.
First of all, I congratulate this PG student. I think his name is Komal. She is attempting a very nice case presentation. Just I want to know, Komal, did you find any pill rolling symptoms or get regarding any observations in your patient at the first visit?
Sir, what kind of symptoms?
Pill rolling symptoms.
Yes, sir.
Okay, you are not mentioning, I think, there. And
I have not mentioned
what
that.
is your observation regarding gait?
Sir, he was stooping forward and the steps were very slow and short.
Okay. The patient says that my chappal is dropped down while walking. I'm not unable to stand. My balance is. I'm not able to control my balance. I think that I am fall down, and many times I think patient is already fall. I think.
Yes, sir.
Yes. Okay. So after concluding Nina sir from allopathic and modern point of view, I am giving you some Ayurvedic perspectives of the Parkinson disease. So in Ayurveda, Parkinson disease is correlated with the Kampa Vata. Kampa means tremors, and Vata is the one of the three basic doshas, basic elements, or there are three humors in Ayurveda. In any human body, there is a Vata, Pitta, and Kapha. These three doshas are the three pillars for bodybuilding and body metabolism and every body functioning. So in them, Vata is responsible. Vata means movements. Vata means air. So out of there are 80 types of different types of Vatas, Nanatmaj Vikara. So Kampavata is one of them. In Kampavata, we are also giving them name as a shaking palsy. Body is always shaking like a palsy. The root Vat dosha, to all students, first of all, I want to clear what is a Vata dosha. The Vata dosha is the gati. Gati means moments, means uh, any types of moments come from your brains and from your Nanindriya, and it goes down to your Karmendriya. The Nanindriya gives you orders. Do lift your hand, go to forward, sit down, this type of. And in your body, there is a gati, there is a moment, there is a transmitter, there is a transmissions. Like the sensory orders, after that motor function, there are motor functioning. So uh, coordination between this sensory and motor function, there is responsible of vata dosha. If vata dosha is aggravated or vitiated, there is a disease of vata vikara. So in vata vikara, Parkinson's disease is mentioned with name of Kampavata. Some of the Acharya says it is a Kampavata. There are disturbed movements and senses due to the impairment of Vatdosha. Some other Acharyas says with name of Vepatu. Vepatu is the Sanskrit word which is described by Madhav Nidan Acharya in Ayurveda. In Ayurveda, exact etiology of any Vaddosh is not known, not known. So Kampavata, that means Parkinson's, is etiology is already not known. But due to the Vata dosha, Kampavata is the disorder. So Kampavata is due to the vitiation of Vata dosha, and it cause which leads to vitiation of Vata dosha, which are responsible to the disease occurrence. Long-term Vata prakopak, that means Vata aggravation, Vata vitiation, ahara and vihara, intakes of foods and lifestyle regarding Vata prakopak, like a dry fruit eating habit, astringent foods in large amount, any type of trauma on your head, or any type of mental disturbance, sleep disturbance, or any type of psychological illnesses leading to the Kampavata, leading to the mental disorder, leading to the Parkinson's. Some toxic medications are also responsible etiological factors for Kampavata or mental health disturbance or Parkinson's. Parkinson's is in Ayurveda, it is a apatarpanjanya vyadhi. What do you mean by apatarpanjanya? Apatarpan means degenerative. Like sir says that it is a neurodegenerative disease. So degeneration is in old age, because in our throughout whole life, while we are in children age, we are growing children. In that age, our body builds, grow, our muscle builds, our muscle grow. In middle age, we are having a pitta, and in later stage there are destruction. That means after 60, our body tissue, body cell, they are destructed by vata dosha. So this type of destructions happens more likely, more in concentration in kampavata, in Parkinson disorder. There are two types of vatvedi, धातुक्षयजन्य vatvedi and margavrodjanya vatvedi. In Dhatukshayajanya Vatvedi, there is a destruction or loss of vital tissues, which are correlated with nerve cell damage in brain, which produce dopamine. That means your cell is not enough to produce dopamine. They are not get enough nourishment, nutrition, not get enough plasma to nourish themselves. That's why they get unnourished. And this is called Dhatukshayajanya Kampavat. Another thing is a Marga Avrojjanya Kampavat. Marga Avrojjanya means in Marga there is a Avrod. There is an obstruction or blockage of proper flow of energy or any other nutrients throughout the channels. That means we are eating something, the gastric juices, any nutrients, it goes down and nourish all the cells like nerve cells, neurons. There is a marga, there is a channel block, there is a obstruction. Due to that obstruction, also Parkinson's disease happens. So there is no specific etiology mentioned in Ayurveda also. In Ayurveda, we, the Ayurvedic Vaidya practitioner, clinically exam with 3 hour pariksha. That means the darshan pariksha, sparshan pariksha, and prashna pariksha. Darshan pariksha means what do you see at the time of first visit, but through your naked eyes. That means observation. Practitioner Vaidya observe patients all physical symptoms such as tremors, rigidity, bradykinesia, or postural instability, which are the indicative of 100% kapavata. But apart from that, we must observe his gait. Through gait observation, how he walk, at the end, we find that his gait expressionless is the key observation. That means patient's face is expressionless. Patients then our second pariksha is a sparshan pariksha. That is by touching, by examining. Through we are giving a nadi pariksha. We examine his rigidity. We examine his stiffness. The body is so rigid, so stiff. His muscle, his tendons, his snayu, these are so rigid. And by sparshan pariksha, we easily understand this rigidity. Then Prashna Pariksha, then we can ask his questions to the patients or patient's relative. So in Prashna Pariksha, we can also, we are giving some test, we are giving some tasks to perform, do your signature, write some letters for fine moments. We are giving some task to just touch your index finger to the nose, just some object is fallen down on the floor, just pick up this object. Like this type of tasks we are giving in a Prashna Pariksha. So these are the clinical examination point of view. These are the diagnostic methods for the Kampavata as per the Ayurvedic point of view. In Ayurveda, there are so many Vata guna, but Chala gun of Vata is aggravated. And Chalaguns mean fast movement. There is a very fast movement having this Vata dosha gun. So this Chalaguna along with Ruksha. Ruksha means dry and Shita means cold. Those persons who have having Ruksha and cold guna in his body with Vata dosha, Chalaguna, the support the disease progression. That means those persons who are bathing with cold water, who are sitting in AC, we are always eating some dry Ruksha products, food, and they are every times giving their body chala. That means moment. In Komal's case, the patient is 10,000 steps walking every day before he get Kampavata. That means this is a advashosh. You are apatarpaning, you are degenerating your muscle, your energy. So if this energy is consumed in your body, then it utilized nicely. You are wasting this through upper limits. So this is called as Shitaguna, Rukshaguna, and Chalaguna impact on uh, Parkinson's to progression of the disease. In Parkinson's, there is a Sarvanga Kampa, head, body, hasta, pada, shiro. There is a walking gait, there are short step, there are chestasana. Any movements you are not able to do fastly and significantly, confidently, and with full effortly. Uh, there is a Shinamati sign and symptoms is told by the Madhav Nidan. Shinamati means your buddhi or your dhi, dhruti or your smruti. There is a imbalance. There is a loss. There is a incommunication or there is a miscoordination for in your dhi, dhruti and smruti. It is called as a Shinamati. There is also Kriya Vaigunya. Kriya Vaigunya means there is a no control and coordination between your motor and non-motor functions. When you are eating some food with a spoon and you want to this spoon and food into the mouth, but this spoon is not goes into your mouth. This food in spoon fell down. So this type of coordinations, there is no control of patients, no control of motor functions. In
Excuse
Ayurveda,
me.
hello.
Uh, it is a great part to listen you, sir, but actually we are running behind the time, so it would be great
Okay,
if you
okay.
take the treatment part directly.
Yes, yes, yes. I'm directly coming on the treatment part.
So on
In
but actually because of shortage of time, na,
yes, yes.
the treatment part and all the pathy.
Excuse me, ma'am. I have a doubt for Santosh
Who is
sir. Can I
this?
ask?
Who is this?
Ma'am, I'm a final year student, BMS student.
Yes,
Dr.
tell
Akash
your
More.
name, beta, and tell your doubt.
So ma'am, for Kampavata, so we can undergo a Bhrungaraj Shirodhara for 3 months. Is that okay? Is that treatment okay for Parkinson's?
Yes,
Uh,
sir is
yes,
telling
yes, yes.
back.
I am coming to this part in a
Yes.
treatment. I am
So
answering your
that is
question
fine
in
only
treatment.
because students are
Yes,
having
in 5 minutes,
doubts.
I conclude all the treatments and also the
Yes,
doubts.
they are having
Yes.
the doubts in treatment
Yeah.
part. If we are
In Ayurveda for Parkinson's, there is a snehan, that means body massage. There are different kinds of medicated oils are available for massage because the muscles and snayus are more rigid. Those snehan treatment is more efficacious in Parkinson. Second line of treatment is a Svedana. Svedana means steam, medicated steam. So in Svedana, Shashtishalik Pindasved is more useful and more researches are already done on Parkinson's for Shashtishalik Pindasved. In Shashtishalik Pindasved, Shashtishali is there, Dashmul or Balakwat is there, and Milk Kwat is there. In this Kwat, we are applying this lepa on patient's skin, tissues, and muscle. This type of Svedana is impactful for micro blood circulation to the skin. And this Svedana, Svedanam Stamba Gaurava Shitagnam, that means शैत्य गुण हरण करने के लिए वो स्वेदन बहुत important रहता है. So the Svedan is also effectful for to cover your rigidity. Then Nasya treatment is also useful. Through Nasya treatment, many Ayurvedic students also know that Nasa is Shirsodwaram. Any type of Shira disorder, Nasya is useful. So Nasya oil, Anutel, Balatel, Mashtel, these are the Bruhan Tela. The Bruhan Tela is also good for to Bruhan your nerve cell, your neuron, because Parkinson's is a degenerative disease. So opposite type of treatment is done. So in Apatarpan Vyadhi, Santarpanjanya Chikitsa is done. So through Nasya, Bruhan Nasya is efficacious in the management of Kampavata. Then Basti. Basti is the whole Vata. Any type of Vata disorder is resolved by Basti. Basti is a Shodhan type of treatment. In Yog Basti and Yapan Bastis are more useful. So medicated oils with Bruhan effect are useful in Basti. There are so many herbal medications are also available. There are herbs like ashwagandha, there are herbs like kapikachu, there are herbs like brahmi, there are herbs like shankhapushpi, turmeric. All these herbs, scientific researches are already done. The dose and standardization is also done. So these herbs are really useful to treat Parkinson's. There are some aristas. Saraswata arista is the best arista to for your memory, for your mental health, and for your confidence. There are some herbo-mineral preparations are also useful to treat the Parkinson's, like Ekangavir Ras, Rasraj Ras, Vat Gajankush Ras, and Smruti Sagar Ras. And lastly, the Murda Tela. Murda Tela, that means tail applying on your Shira, Shiro Abhyanga, Shiro Dhara, Shiro Pitsu, and Shiro Basti. These four parts from the Murda Tela are useful because head is the part where your disease start. So in your Shira, we are doing some medicated Abhyanga, we are doing some Dhara, we are keeping some oil in the Pitsu format, and we are doing shirobasti, which is really helpful to improve patient's quality of life and reducing his symptoms. Ayurveda is not claiming that Parkinson's is 100% curable disease, because in Ayurveda, Parkinson's is a asadhya vyadhi. Parkinson's is a asadhya vyadhi. We are ensuring that his quality of life and his symptoms we are going to reduce with improving his mental health. So this is the Ayurveda deals with the Parkinson's. Hello, Netke ma'am.
Yes, I'm here, sir, listening
Yeah.
you. I'm just requesting the student if the students who are from Ayurveda or any other pathy, if they are having any doubt or wanted to know more information about the Ayurveda treatment point of view. One student asked about the Bhungaraj Swarasa
Yes,
Shirodhara.
Bhungra scale is also effective for Shirodhara, Shirobasti, Shiropitsu as well as a Nasya. It is a
Yes, and to add on, I can also say that we can give the basti to the patient. Vajigandhadi Niruha. We used to give the patient to Parkinson's patient Vajigandhadi Niruha basti. So they may get the control towards the tremors. And Kapikachu we have discussed in detail about the Zendopa product and the
yeah.
Mucuna pruritus. So Kapikachu is having wonderful result, but as Nina sir mentioned, it will require more. I think it require more clinical trials should happen over that, and we can recommend this. We can recommend this to the patient then later on.
Okay,
So
one message in I think chat box. Adravya Chikitsa in Parkinson's. Adravya
yes.
Chikitsa in Parkinson's is a meditation, is a pranayam, is a yoga. See, it is a Adravya Chikitsa. So patients if following meditation, he is concentrating and his sleep is almost good quality. No, the Parkinson's disease is slow down and dopamine level is also goes on increasing.
Mm-hmm.
So sound sleep is the most good quality. If patient having a sound sleep, no, there is a nothing problem with the dopamine layer. This problem generates with so many chronic illnesses which impact sleep.
I can add on to the students, especially I am telling this point कि पार्किंसंस एक बार हो गया तो वो रहना ही है. मतलब वो हो गया तो वो ऐसे खांसी बुखार नहीं कि अगर हो गया तो वो ट्रीट हो जाएगा. हाँ, but what can you do? You can maintain the patients with these are just remedies. आयुर्वेदिक ट्रीटमेंट हो गया या होम्योपैथी हो गया या एलोपैथी का हो गया. These are just remedies to maintain his lifestyle. बाकी उसका जो प्रोग्नोसिस होना है वो बैड होना है. बाद में पैलेटिव केयर उस पेशेंट को लगना ही है. What we can do the quality of life to the patient. Quality of life कैसे दे सकते हैं? We can do the daily abhyanga, daily physiotherapy, then shirodhara. These all are the remedies to give him a quality of life कि उसका life ज़्यादा deteriorate ना हो और वो अच्छा lifestyle जी सके. These are the remedies and this is all about the Parkinson's only. We are having the homeopathic opinion. With us, we are having the Dr. Rasika Dharmadhikari. Madam is an assistant professor, but she is having the experience of associate professor from the Dhondu Mama Sati Homeopathic Medical College. And she will focus on homeopathy part as we covered the Ayurveda part, allopathy part, also palliative care we have discussed, meditation, pranayam we have discussed, but homeopathy we are not aware what is told in homeopathy. So I request Madam to enlighten this part according to homeopathy point of view. So welcome, ma'am. Please start.
Thank you, Anushri ma'am. Am I audible?
Yes, you are.
Yeah. So, ma'am, I think Santosh sir and Ninad sir has explained very beautifully about the conventional medicine as well as Ayurveda. As we are short of time, I think I'll just focus on the homeopathic rule, like what we can do for these kind of patients, because we are talking about a condition which is progressive, incurable, chronic, and we all know what eventually is going to happen. So in homeopathy also, ma'am, the scope will be if we can diagnose it early and if we can intervene early. Early is the better. We can start with the homeopathic medications. When we talk about chronic conditions like Parkinson's, I think homeopathy can be always used as an add-on therapy. Like just to give you a gist, we have conducted a research in DS Homeopathic Medical College on Parkinson's disease and homeopathy, where 30 sample size was there. 15 were given homeopathic medicines along with their conventional line of treatment, which was continued, and 15 were only kept on the placebo. and we have received a positive result in these cases. So how we have treated, basically constitutional medicines is the main, they have a main role in treating such conditions. And then you can also talk about certain local remedies, like it could be zincum metallicum in low potency, causticum agaricus like remedies in lower potency. But as you must be knowing that homeopathy is based on individualized approach. So I'll not be able to tell you that these are the medicines which can be used to treat any case of Parkinson's disease. But after taking proper homeopathic case, we can come to a conclusion and we can start with the homeopathic medicines, and they definitely help the patient, because at the end of the day, we all are talking about improving the quality of life. So I think to treat conditions like these, we need to have a multidisciplinary approach where we can have a holistic approach. We can use multiple pathies and give them a better quality of life. That's it from my side, ma'am.
Yes, yes. Very short and sweet, ma'am. Actually, that is you have mentioned the moral of all this session, that what
Yes,
we
ma'am,
can
because I was the last person to talk. So because we are short of time, I did not want to waste much time, and I do not
But
want to
sometimes
repeat
you can
everything.
you can have, ma'am, if you want to explain more about the homeopathy treatment
No,
point
no,
of
I just wanted to emphasize that more and more research has to be
yes,
conducted in
yes,
this
that is
area, because even when basically
that,
Parkinson's was my dissertation
yes.
topic, and when I was doing my dissertation, I got to know that hardly 2 3 researchers are there, especially I'm talking about homeopathy, that homeopathic medicines and Parkinson. Zincum
Hmm.
met was one of them, that was also an animal study. So I
Yes.
think if homeopathic students are listening to this, more and more research has to be done, because today we are living in an era of evidence based medicine, and if you do not have a evidence, then you cannot say much, right?
Eye
So
opener. This can be eye opener to Ayurveda and homeopathy students also, madam.
yes.
As the allopathy doctor, Dr. Nina Thoras sir is saying that he is having some patient, and he is having the patient is having the Ayurvedic treatment, that is mucuna, and I am very sure the mucuna is having mucuna pruritus, that is kapikachu. And the patient from US and UK are taking the Ayurvedic treatment, and in India we are just listening to other people and not doing any kind of research on this. And I think this session, today's session is eye opener for our students, that they should consider the research part in their academic activities also. So this is all about the Parkinson's disease, and I think we had a very healthy and nice discussion about the Parkinson's in point of view allopathy, in point of view Ayurveda. Sir has explained very well what we can do, what remedies we can apply to the patients, Parkinson's patients. In point of view homeopathy, you had explained very well. So I think this is all done from our side, and we can conclude this session. So I'm very grateful to all of you, all the participants who have joined here and on YouTube. They are listening very patiently, and all our viewers on YouTube also. I would like to thank Komal. She has presented very well and has being a. I'm not discriminating, but still we are homeopathy and Ayurveda students. Still, she has tried to answer the neurologist directly. So I appreciate her. And also, I'm very thankful to Dr. Meena Thorat sir. Sir is actually stuck with patients, and he was having OPD, but still he somehow he spared the time to attend our session. Then Dr. Santosh Kamble sir, he has spared the time and he enlightened the Ayurveda part very well, so student can get the clear idea what they want, they can do, or they how can they treat the Parkinson's patients. And also, I'm very thankful to Rasika madam that she has very sweetly mentioned all the homeopathic point of view. So this is all done from my side, and thank you all of you. So we can leave the session now.